Dr. Shinde. I'm a doctor of physical therapy. We have physical therapy, we have chiropractors here. We also incorporate massage therapy and we have an acupuncturist here. So when you do a combined therapy, physical therapy, chiropractic, blend in with like some massage therapy and acupuncture, it helps with like faster prognosis with a patient. I mean, you feel benefit just with PT or just with chiro, but it might take more visits to get to your goal than when you have a combined therapy. The practice is located right at the beginning of Soho and NoHo area, so it's more like young population. People working around here are like weekend warriors, athletes, people who like sit in offices for too long, but the population ranges from like say 20 to like 50 years old. So most of the patients that we see here are like come with shoulder injury. Very commonly it's rotator cuff tendinitis. It's most likely seen in patients who have like repeated injuries or like direct trauma to the muscle, but also in patients who have like bad posture. So functionally the alignment of the muscles isn't right, and that was caused like repeated inflammation to the tendon in your shoulder joint. The only attachment, bony attachment that your shoulder joint has is from the clavicle to the sternum. But other than that, it's just based like hanging there on ligaments and musculature. So it's more prone to injuries, especially when you're doing repeated overhead activities or repeated activities that involves throwing movement. That's when your shoulder joint is prone to like more injuries. So most of the time we see rotator cuff injury or any other shoulder injuries are people who are going to CrossFit, swimmers, tennis players, runners. They're not doing overhead activities, but it's a repeated movement in your shoulder joint which could cause tendinitis, inflammation to your rotator cuff tendon. So just to give an overview of your shoulder joint or shoulder complex, it is dependent on musculatures and ligaments around. Your rotator cuff has 4 muscles: subscapularis, infraspinatus, teres minor, and supraspinatus. So with response to prognosis, it depends how bad is the injury. So it just could be like tendinitis where there's inflammation around the tendon, or it could be like a tear in the rotator cuff tendons. Again, the tear could be partial, it could be full thickness tear. So when it comes to just tendinitis or partial tear in your rotator cuff muscle, you could see between like 6 to 20 visits in your healing time. Most of the time the patient just comes in. It also depends how sooner you come for treatment. The sooner you come, the faster you're going to heal. Only time I've seen someone needs surgery is if it's a structural issue where you have, say, bone spur that's causing tear on your rotator cuff tendon, or if it's arthritis where it needs to be cleared out surgically, or if it's a full thickness tear where it has to be like repaired and use some other muscles to like stabilize the joint.